When someone starts dialysis, it oftentimes can be overwhelming. So many new things to understand, beeps going off on the dialysis machine, and feelings of weakness, fatigue, or cramping while on treatment. Well, let's get into it for those on dialysis for years or just getting started. 4 things every dialysis patient needs to know. What's up, San Antonio and world? I'm Dr. Qasim Butt and I'm a kidney doctor, and I'm here to break down health in a simple way. So you're on dialysis and you're kind of confused or just want to know more about your health. What should you know? The first thing you should know, you have the power. Oftentimes dialysis patients feel stuck. This is my dialysis unit, this is my doctor, and I just have to live with it. Nope. You can control where your healthcare dollars can go. So if you think your dialysis unit does not treat you right, or your doctor does not respond to you well, guess what? You can change them. Now, before just willy-nilly just changing your dialysis unit, I would probably have a team meeting with your clinical care team, your social worker, your nurse, or your doctor to see if all your problems can be ameliorated. But just so you know, you can change if you need to. Also, just FYI, you can check out your dialysis unit's star rating on the CMS website, Center for Medicare Services website, link listed right here. Next, know your labs. It's crucial for you to know your labs and ask questions about them. The ones you should inquire about the most are your potassium, your phosphorus, your albumin, and the weight gain in between treatments. Look for trends in these over time, not just one single value. These ones in particular stuff you have control over. Ask what you can do to help make them better. And guess what? The dietitian there is likely to be the most helpful. High potassium can stop the electrical activity of your heart. High phosphorus can calcify your circulation over time. Low albumin can mean poor nutrition and show the poorest overall outcome in your overall prognosis. And excessive weight gain puts extra fluid on your body, which puts a burden on your heart and can cause you to get short of breath. Now, this one is really crucial and one of the biggest trends in kidney care as a whole, that home dialysis is an option. Always remember that you can do this from home, by yourself, or with the help of a family member. Yes, you can. All right. The 2 options are home hemodialysis, similar to the one that you do in an in-center setting with needles and blood, but also peritoneal dialysis, which involves no needles and no blood, which has a tube in your abdomen. These have been shown to have better outcomes, longer lifespans, and give patients more freedom. Make this a serious consideration. When you do it, you have a nurse on call 24/7. You're never alone. And let's say you hate it after, say, a few months, you can always come back to the in-center dialysis sessions. And lastly, am I on the transplant list? This should automatically be in your mind. How do I get off dialysis? Well, it's a kidney transplant. Start to think of dialysis in a different way. Dialysis should be a bridge to a transplant, okay? Make sure you're referred to a transplant center early. The best person to ask is both the nephrologist and the social worker in your dialysis unit. Now, not everyone qualifies for health and various other causes, but if you don't, you should know the reason why, because perhaps it's something you can actually fix and improve on. Well, let me know what you think in the comment section below. And remember, it's your kidneys, your health.